She has repeatedly, and the physicians have repeatedly asked to be able to testify and put at least forward into the discussion the position of many of us for a much more rational and universal plan, and never has even been allowed at the table to present the views. So it's with great pleasure and honor that we present to you a representative of all of the 18,000 physicians of a national health plan, and the one who has been most outspoken and most courageous, Dr. Margaret Flowers.
It's so wonderful to be here. Such an honor for me to be with such a group that is so dedicated and compassionate and caring. I was honored to participate in the health workshop on Friday, and just was astounded by the depth of compassion of the people that were present there and their desire to see a healthy and caring world. I'm a pediatrician. I'm a mother of 3. Never really intended to take a path of becoming arrested for healthcare reform. But when I was in practice, I was seeing a situation that was just intolerable for me and for my colleagues. A situation of fighting with corporations that are only interested in their bottom line and their dollar, and they don't care about the patients, they don't care about the health of our people. And it was making it, and it is making it, impossible to provide quality health care in this country, and we're losing good doctors because of it. My friends that I work with say all kinds of things about our healthcare situation, because we don't have a system, we have a situation here, a very serious situation. They say it's irrational, they say it's unethical, it's unjust, it's cruel. The current situation and the way this incentives are aligned actually worsen the health of our people. They drive us to put obstacles in the place of getting care, to put obstacles in the place of getting medications and tests, to put obstacles in the place of the physician-patient or the caregiver-patient relationship. We're all frustrated by what's going on, and we're taking it out on each other, and that doesn't work. So, we had a really simple ask this year. If we're going to talk about healthcare reform, let's talk about the realities of what's needed in this country. What are the problems and how do we address them? And we were refused. What we found was that this whole reform process was determined ahead of time, before the president was even elected, and everything that from the House parties in December all the way through was tightly scripted and tightly planned to make us believe that we were going through a process. As Katie Robbins of Healthcare often says, it was looking at people going through the motions of what might be a healthcare debate, but it was really a charade. This is not acceptable. We're the only nation, industrialized nation, we spend more than 2 times what other people spend, and we leave 50 million people out completely, and we have another 50 million or so that are underinsured and financially vulnerable if they have a serious illness. So, I wrote some notes so I wouldn't get offline, but I did. Anyway, what we saw was, well, there's 2 ways to think about healthcare. If you want to break it down really simply of how we differ from other nations. You can either believe that health is a commodity and patients are consumers, and that's where you try to fit medicine into a market model and think of it as a business. Or you can think of healthcare as a human right, as a fundamental right and a public good that benefits all of us when we have a healthy society. And what we got from this reform was more market-based provision of health care. We are further enriching the very industries that are the problem in the first place, and we are not addressing the fundamental problems that we have. So, there's no way that we're going to tweak this current reform into something workable, because it's based in that market model. We have to change the conversation. We have to change what's happening, and we're dedicated to do that. One thing that's given me great hope is the energy that I've seen coming from the single-payer movement, because people are not giving up. They get it. They know that we didn't get reform. And we're not going to wait to see it fail. We're going to continue to fight. It's too important. We know that we rank the highest in preventable deaths in the world, in the industrialized nations. That's not acceptable. We know that people are suffering, and that's not changing. People are losing their homes. People are getting sick, and their first thought is, can I afford the care that I need? It's the wrong discussion. So, I learned a few lessons during this last year and a half of being here in Congress. I just want to tell you first a little what it was like the couple of weeks before the legislation was passed, because it was really a strange experience for me. It was reliving what we've seen happen over and over the last few decades, where people were saying, there's too many people suffering, we have to do something, this is the only thing we can get, so let's pass it. Knowing that it wasn't a solution, knowing that it wasn't going to address the problems. And that's what we've been told over and over again, and we've accepted that. I saw good people, good-hearted, well-intentioned people supporting legislation that they knew wasn't going to work out of desperation and being told it was the only thing that they could get. We can't do that anymore. It's only taken us down a worse path. So the three things that I learned, and a nurse friend said, oh, ICU. The three things are ICU. We're in a crisis. We need intensive care. So the three things are independence. We have to be independent as a movement, demanding what we need for ourselves as people. It doesn't matter who's in the White House, really. It doesn't matter who's in Congress. What matters is us. That we come together united and uncompromising in what we're demanding. Clarity is what the C is. We must be clear about what we want. We need to educate ourselves and others and know what's acceptable and what's not acceptable. And the U is uncompromising. When I look at our European counterparts and what they have in terms of social infrastructure and then what we accept here, it astounds me what we're willing to take, knowing that it's not a full solution. So we've got to be independent, clear, and uncompromising in our convictions and demanding what we need as a people. And that's what I'm dedicated to doing, and that's what Physicians for a National Health Program is dedicated to doing. And I just wanted to make one more point. Medical care is really only 10% of our health. Just getting a health system is important, but it's not the end. 90% of our health has to do with social determinants. It has to do with whether we're adequately educated, whether we have shelter, whether we live in a safe environment free of violence and toxins, whether we have an adequate income, whether we have a life of dignity and respect and equality. And so I'm calling on all of us to come together and recognize that the big picture is that we have to create a social movement that demands social and economic and environmental justice for our people. And healthcare is part of that, but everything else is connected. And so that's my challenge to you, is to say, yes, we want Obama to be the president that we hope that he would be, but it's got to be up to us, coming together and demanding what we need. And so go out, please, and spread the word. Organize, get involved, and let's do it. Thanks.